The burden of HIV/AIDS across the world is not about to end. Instead, it was worsened by the COVID-19 pandemic, raising the number of new infections and disrupting treatment plans for many people across the globe. And rightly so, because the threat to life by COVID-19 was huge and called for immediate response. The Director General of the Uganda AIDS Commission, Dr. Nelson Musoba, says Uganda's HIV response is largely donor-funded.
Close to 80% of the money in the HIV response is from donors, and the largest donor currently is the American government. But we've started conversations as government. Government recognizes that HIV is such an important area, especially the medication, that government would want to, take control as much as possible so that.
According to the U.S. mission's report to the Uganda people of 2021, the U.S. supported Ministry of Health's Pharmacy Department to improve forecasting for pharmaceutical needs and monitor stock levels and supply chains. Furthermore, 55,000 new patients were placed on HIV treatment in 2020.
This fiscal year, which for us is 2023, the PEPFAR Country Operation Plan budget for Uganda is $400,200,000 US dollars, or just under 15 billion shillings. This commitment reflects support for equitable HIV prevention and treatment and care services across the nation, implemented through strategic investments deemed critical for the country's progress towards controlling the epidemic through collaboration by the PEPFAR team, the government of Uganda, civil society, and other development partners.
But what is Uganda's contribution? Dr. Nelson Musoba explains.
Government of Uganda is contributing about 12%. It is a significant amount of money. It's about 170 billion Uganda shillings every year. So the conversation we are having now is that let sensitive aspects of the response, like antiretroviral drugs, like HIV testing and counseling, like condoms, be funded by government of Uganda.
Dr. Musoba says they are working with the donors for a roadmap that will see government take over full financing. He says the plan is to start with key areas like treatment and prevention campaigns, but the government is expected to match an 850 billion shillings gap every year.
If government was to take over treatment fully and manage it, we are talking about 1 trillion shillings annually. And there they would be managing it 100%.
And for the alternative, Assistant Commissioner Patrick Mwesigye from the Ministry of Finance says they have put forward some measures within the budget to provide the needed funds.
Health insurance, which is high on the legislative agenda, we think that is a big opportunity that we can use to supplement resources to replace the exiting donor contributions. There is the issue of the need to have a health financing strategy where you focus on reducing the disease burden.
There is no doubt that the work of partners in financing critical health interventions is needed, especially by low and middle income countries. That is why the Global Fund to fight AIDS, tuberculosis and malaria is asking global leaders for $18 billion, approximately 67.2 billion shillings, to tackle these health issues. Walter Mwesigye, NTV.